welcome to the webinar, to this workshop actually, and I'm going to give Piret the word. I think you are already co-host. If not, I'm going to make you right now. So see if you can.
I'm not going to make any presentations, so
okay,
that's cool. You don't have to share anything with me.
Okay.
So hi everyone. I just thought that it's better to see my face rather than to see these slides. So that's why I decided, because later on you will see slides anyway. And yes, my name is Piret. I will tell you a few words about my background, maybe a few words about also about Connected Health Cluster and Tehnopol, why we are in this project. And then later on, I will just give you like few key words, what we are aiming for during these 2 years that is ahead of us, already started actually in January, and what are the aims or what are the activities of the projects we are planning to do. So my name is Piret Hirv, and I'm a manager of healthcare technology division in our science park Tehnopol, and also a manager of the Connected Health Cluster. Few words about my background. I have a degree in health tech, in healthcare technology from our University of Technology, and also I'm a nurse by education. So I kind of do understand the person side and also the technology side of innovative solutions. And our science park Tehnopol is the leader, or like managing the Connected Health Cluster, which is a ecosystem of different companies developing innovative solutions. We also have in our small ecosystem, we have representatives from the academia. We have representatives from the government, Ministry of Social Affairs and Health Insurance Fund. We also have representatives from this, or we call them like needs-based partners. Namely, they are healthcare service providers, big hospitals, smaller hospitals, family doctor units. So we are trying to cover the whole ecosystem if you want to implement innovative solutions in healthcare. And in our Connected Health Cluster, we do co-create innovative solutions, but we also push them to the other markets across the border, because Estonia is a beautiful place where to live, but it's so small. So you just have to do solutions for export in order to also to make living out of it. So these are the two main activities. And why we are in this project is, because we saw that we do have people or stakeholders who actually do need innovative solutions. And then we have companies who are creating beautiful solutions. And for somehow it's still not functioning. And I'm getting old. So in the future, I do need some innovative solutions to be comfortable at home. So that's why it's a very personal issue for me to get innovation flowing or distribute innovative solutions across the border as well. So, and now a few words about the project. It's a 2 years project, and we have 9 partners at the moment from different parts of Europe. I'm not going to call all the names of the partners, but I will tell you more about the activities where the partners are involved, so you will understand better what we are planning to do. I mentioned our small ecosystem here in Estonia, but you can't do anything without the stakeholders. This we have learned here in Estonia, and I guess this is the true. This is true also in Europe, across the Europe. And actually, what we are trying to do is to engage active and healthy aging networks and stakeholders in creating a common structure for scaling innovation and cooperation in health and care across Europe. And actually, what we are trying to do is to collaborate with all the relevant stakeholders. And I believe that many of you joined to this workshop today, namely to see what is your role or what could be your role in this project, and how you can contribute, and vice versa. We need to learn from you how we can contribute your work. So it is really important to have this dialogue running. I told you about what we do here in Estonia in our ecosystem. So co-designing is one of the key elements of this project. And we are trying to go through the process or ensure the long-term cooperation within the healthcare ecosystem by building a connected base of knowledge that considers already existing solutions and provides validated model for the process of co-designing innovation in health and care sector. So unfortunately, because the time is so short, we can't work with very novel solutions. But the idea is to have a very clear understanding from what level up we are, the solutions from what level up we are working with, and trying we will try to scale up those solutions. Unfortunately, no new solutions due to the time restrictions. Of course, when you need or when you are scaling up or when you're developing your solutions, to scale up your solution, you need to test it. And not only in your own country, but also cross-border. And this is one of the key elements or activities of this project, to have this possibility for cross-border testing. And of course, it's really important to understand what is the innovation that we are developing, or this innovative solutions, what is it doing? And is it actually effective, and how to evaluate the actual impact of the innovation? So also the framework for innovation and impact evaluation will be created during this process or this project. And last but not least, you need money for innovation or for developing and scaling up innovation. So also we develop a model for long-term investment or long-term investment strategy, and it is really crucial to identify the elements of cost efficiency, and it's important to have a roadmap to increase investments into innovation and social impact. So one thing what we are aiming to do is to have this long-term investment strategy. And of course, to sum up all this work, what we are doing during these 2 years, we need to design or propose policy kind of adjustments or suggestions or how to improve the overall situation in Europe in terms to scale up innovative solution in active and healthy aging. So also policy recommendations. And what we are planning to do is to do a lot of awareness raising, dissemination of information. So this is also really relevant and big part of the project. But coming back to the beginning of my presentation or speech, none of this can happen without the stakeholders, and that's why we have this first workshop organized with you. And Claudia, I think that now it's a good time for you to take over, and really, yes, don't hesitate to contact us, and don't hesitate to propose your ideas. So this is something that we really need to be successful in our work during these 2 years and also in the future. Thank you.
Thanks a lot, Piret. As you said, and I think you closed off in a way that allows me to do a proper segue. It's really about also warming up to our stakeholders, trying to understand what they are saying, their opinions, their questions about these developments, and in the future understanding the way forward. We have a project for it, but there's a lot inside these actions and these work packages that we can do. And this is why these contact point with the stakeholders, it's important. So moving on to the next point in the agenda, I would ask Karina Dantas to present. As I've said in the beginning of our workshop, she's the CEO of Shine to Europe. She is also one of the coordinators and one of the main figures of D4 Action Group, which is related with age-friendly environments. And she's going to present to us a bit about her experience within these networks, within these groups, what has been done, and what lessons have been learned, and what are the next steps. So without further ado, I'll give the stage to Karina.
Thank you so much, Claudio. I hope you can hear me well. Thank you also for the invitation to be here. If you don't mind, I will share my screen, and I will start with a disclaimer, which is I was given 10 minutes, so please acknowledge that it would be impossible to even summarize what was the IP, at least connected to the D4 group, in 10 minutes. So what I can do is just try to bring some highlights, but I start with this photo as I could have started with any of the others, just to say that the IP for us for a long time was a community, was a group of friends. A lot of my close friends come from here, even if they are in different countries. And I think this is a shared opinion of a lot of us. And this personal connection is also something that makes us keep working together, even if on a voluntary basis so many times. So this for me is mainly the heart of the IP in this sense. And as I said, it would be impossible to summarize so many wonderful things that were done within the groups. So what I bring today is only 4 of the outcomes of D4. A lot of them are also placed within the sustainability plan and the outputs that were produced in the previous CSA. Well, we need to start from somewhere, so I will go on with this. And I already apologize for the ones I excluded. So it wouldn't be fair if I didn't start with SHAPE and made a very quick overview on this. I also put this presentation on behalf of Willeke. In the course of the work of the D4 group around 2017, everyone, as you probably remember, was saying that people should age in their own homes. We should give them the conditions to do this. And a lot of different strategies were being thought of, and this connects to many of the other EIP groups as well. However, as you know, age-friendly environments have a very specific angle, also connected to the building industry and to the urban planners, architects, etc. So our main question was, a lot of things are going on, but not that often they connect to this industry, to this part of knowledge. And we thought there was the necessity to bring together 4 main aspects of aging, which were healthcare, social care, the building industry, and ICT. And we were wondering if they shouldn't talk together, either in terms of policy and funding, so that we could progress and in fact allow people to age in their communities. So we had a thematic network approved in 2017, a smart, healthy, age-friendly environment. This is how SHAPE was born as a concept. And at the time, we were very successful in putting together a big number of partners, namely international networks. Some of them are here today, and a lot of different organizations. During 2017, we made a big consultation, either with experts and with citizens. We made a joint statement and a framing paper that was delivered to the Commission and to the member states. Well, these were more or less the overall partners, so more than 170. And this evolved to a stakeholders network at its end. So this network is still maintained, and a lot of the people that we still work with are collaborating on a fully voluntary basis. So what were the 5 main areas that we proposed to have and that we still think are very much in line with current policy strategy, let's say? First, that we need a shared vision between different areas of knowledge. And this was something that we also tried to discuss within the IP, that we prefer to try to bring the different silos together and have this connection between health, social care, ICT, and the building industry. And for this, of course, we need to communicate more and cooperate more. And this was, of course, the main angle of a thematic network. Then it's very nice if we present this policy statements, but this doesn't work if we don't have money. So one of the perspectives where SHAFE tried to work on was to also provide some materials and specific action points that could be organized within the regional and national frameworks, so that national funding and regional funding was also aligned with this more holistic vision of intervention. And of course, also try to provide the stakeholders as much as possible with conditions for implementation. Of course, this only works if research is aligned and also if citizens are involved. And of course, this comes with the last part of the stakeholders that we're missing. And in this, a lot of work in part of training and awareness and education of citizens is also being done through the network to try to provide some citizen empowerment and more involvement in the democratic processes. So at the end of 2019, there were two big words coming from SHAFE. It was cooperation and implementation. And this is how we have been working during 2020. So we released a position paper in 2020 explaining that I think probably coming to an agreement with so many different stakeholders in the area, we need to have an inclusive environment. This needs to be for all kinds of people, not specifically older people, but to people of all ages, because if it works for one, usually it works for all, or at least it should work for all. And that we need for sure to make this work with the digitalization of society, because we completely acknowledge that digitalization is now one of the main angles. And of course, it's a very important tool and even a very important framework for things to be discussed, but it cannot solve all. So connected to this digital transformation, we try to bring some attention to the gaps and also some actions that try to tackle these gaps, namely the need to improve digital skills of citizens, health literacy, participation, and prevent inequalities, to try to align house retrofitting and infrastructures, mobility, etc., along with the ICT, because this is something that sometimes hinders the use of the digital innovation. And of course, to also, to also try to align the health and care implementation with all of this. So having reliable data, trying to provide integrated solutions that are centered on the person and that can be feasible and sustainable over time. So we do acknowledge that all of this is interconnected and that this holistic approach is for sure needed. And this, in my perspective, is a big asset of the IP. We had different working groups, but they also talk to each other. So this is something that for sure we need to foster for the future. So I think I more or less went through this. This can be information that can be shared at the end. It's a bit of the summary of the position paper we released, and with it we also provide some indicators, some specific areas to tackle, and actionable points. So this is all available, and I can probably share it at the end so that I don't take too long. We are trying to implement SHAFE in so many different ways. We have several different projects ongoing, some in which I or my organization is in, but others not, because all the stakeholders can just take advantage of the concepts and the strategy and implement it in different ways. During 2020, we had a new action approved. It's a cost action that intends to implement smart, healthy, age-friendly environments. It gathers researchers and stakeholders from all different sectors. And we have now more than 270 stakeholders involved. From the quadruple helix. So this is also something that will help to foster SHAFE. We are producing different types of results from here, but the main point is that we could enlarge this to a number of countries also outside of Europe. So now we are all drafting together this different areas of the flower, the user-centered design, the integrated health and well-being pathways, digital solutions, and impact and sustainability. And we intend to put it all together into a reference framework that will help every local or regional ecosystems to implement this in their own community. One other of course, big and representative asset of the D4 group was the European Covenant on Demographic Change. So this is also something that is aligned with everything that has been discussed, and that has a very big target on tackling the demographic change, of course, aging, but also any other societal changes associated to it. It is mainly targeting local and regional authorities. And this is very important because this is an angle that sometimes is not the main focus of other networks. So this is why they are so complementary and they work together this well. It now in 2020 has almost 160 members and in 24 different countries in Europe. And the last but not least result of the D4 can also be the certification for aging in place that it's just now ending, led by Tecnalia in the Homes for Life project. This is quite important because this is now a very specific product that can be applied to certify smart homes. And this for sure is one of the assets that came initially from the D4 group that can also be implemented in place and support the implementation of these age-friendly environments. So from my part, this was it. I know it was a lot of information in a very short period of time, but as I said, 10 minutes will never be enough. I hope it could give some highlights, and I'm open to any questions you may have. Thank you.
Thanks, Karina. You're right. I mean, 10 minutes is a daunting task to do something of the sort. But we are trying then with the discussion, I think we can flush out some of these topics. And now presenting, I would ask Melanie Lario. She's been the coordinator of the Campania Region Division on Health Innovation. She's also an assistant professor, researcher in the Federico II University of Naples. I hope I'm not butchering any of these names. And a co-chair of the European Reference Site Collaborative Network. So I would ask Madalena to start her presentation. I see she's already sharing the slides. So this is my cue to leave the stage.
There we go. Hi, good afternoon, everyone. Thank you for the invitation, and I am privileged to present after Karina. As she said, during the work we developed in the EIP, we had the opportunity to build so many friendships, and she's one of the persons we have been working with more closely. I will share with you the collaborative experience we developed in the EIP that brought us to the setup of the Reference Site Collaborative Network. So during the period when we started to work in the EIP, we did not have the challenge yet of the COVID, but still we could identify some of the challenges that have been worsened by the current pandemic. We still could spot in our regions throughout Europe health inequalities and social needs, and these kind of challenges have been even growing deeper during the pandemic, and hence the need to align investment in order to sustainably address the increasing cost for complex needs of our citizens. And then the objective of the EIP became even more fitting of to the current situation. So the framework where we have been working in the EIP saw us busy in contributing and collaborating along two different lines of action. One was in the reference sites and the other one in the action groups. And we were supported by the two different CSAs in the development of the blueprint for the digital transformation of health and care, that is the shared framework that allowed us to progressively develop the actions that we could support us in the alignment of our objectives at local, regional, national, and international level. And then we also collaborated along the development of an innovation to market strategy and a digital tool to support the monitoring of our activities. So we were all busy in scaling up this digital innovation while we were trying to build at local, regional level our ecosystems around a quadruple helix. The quadruple helix of innovation saw the reference site busy in developing meaningful and collaborations across governmental organization, academy, industry, and civil society in a structured way and around valuable activities. And in this framework, there were also the action groups, like the activities of the thematic action groups that were growing in the EIP. And the first lessons we learned was that it takes many networks to implement. The amount of work and the dynamic that are ignited by when you start to build an ecosystem for the innovation of health service provision requires many skills and competencies, and this is the first important lesson we learned. And we also identified that there was an opportunity there for the reference sites that were growing in the EIP to join forces into an established network. The network was informally started in 2013 after the first call for reference site was issued, and it was a bottom-up initiative by a first group of reference sites that simulated subsequent involvement of other reference sites, and it currently counts 104 reference site members. We became a legal entity under Belgian law in 2017, and since 2013 we have been supporting the Commission with experts, keynote speakers, and collaborative activities in our community. And since 2019, we have been also developing relationships with regions and the ecosystems being born outside of the EU. And we have been also working towards strengthening the collaborations with the action groups. Our mission is to support the reference site to promote actions on active and healthy aging in line with the decade for active and healthy aging that has been launched by WHO. And because we would like to accelerate the deployment of innovations for active and healthy aging to improve health and care outcomes. We are convinced that this will improve the sustainability of health and care system and also ignite dynamics of growth in different market area. We are supporting our members to accelerate the adoption, the development and the adoption of innovative solutions that can prove effective into delivering impact on active and healthy aging for citizens and for patients at individual and collective level. And we believe that we are already contributing to to improve the sustainability of our health care systems and social health system. We also believe that thematic groups are highly valuable because they ensure that the high level of policy making stays connected with the bottom-up approach. And this is a virtuous circle that can improve the identification of the most pressing challenges to be addressed by multidisciplinary expertise and competence. And this is also a way to foster capacity building and also break down isolation of the groups that can provide skills and competencies that may not be connected yet to a reference site in the region. The twinnings between the reference site can help in sharing strategies and approaches, and this can strengthen the development of person-centered services. There are a number of examples of policy changes that are the hardest achievement that can be reached by a reference site. And it is seen by the appearance into the policy documents of the regions of the content that has been developed inside the reference site and as a product of the European projects. For example, if in this list I can spot EU SHAFE, but you heard about it by Karina, but we have also Sanfrail tool that is to screen and address frailty in community dwelling older adults that is now appearing in the strategies of the regions and in healthcare plans for the adoption of innovative approaches to prevent phrased in community dwelling or their adults. This is just one example. We have Styria program for nutrition and health for active and healthy aging that was developed around the work of the University of Graz. We have the work carried out in Twente, and so on and so forth. And apologies if I do not have the time to mention all the excellent work carried out inside the reference site and the action groups. There are also good practices that are being deployed by a number of thematic groups, and they have been developed in coherent work across several projects, because it takes often one single project, innovative project, may not be enough to transfer an innovation. So you need to go through a couple of rounds of twinnings before this innovation is adapted and customized and is ready for the adoption of a region, of a reference site. There are a number of opportunities in the end of the day that we see ahead of us, and we are trying to strengthen for scaling, facilitating the scale up of innovative good practices and knowledge exchange, support our members to do it, and support innovation to circulate. So I would like to thank, this is a work that has been growing on the efforts of, on the voluntary efforts of many people. And I would like to thank the two CSA actions that have been supporting us in the past, all action group coordinators and partners, and the RS, my co-chair, Jean Bousquet. We are co-chair, and I'm very proud to be a co-chair with him. The executive board with Anna Cariazo, Marita Perele, Jawad Tajam, John Farrell, the head of policy and operation, Lisa Lenardin, the treasurer, and the secretariat, Gabrielle and Giovanni. Thank you.
Thank you, Maddalena, for the presentation, for the explanation, also for this quick sum up of what have been some of these activities. Well, I would now invite Elisio Costa from the Porto for Aging reference site consortium and part of the University of Porto, and Valentina Palilas from IREGA. And we're going to promote a bit of a discussion with Karina and Maddalena about some of these topics, some of topics lifted during their presentations. So please do put yourselves on this virtual stage.
Valentina, I don't know if you want to start or if I can start.
Please go ahead, Elisio. Yeah, okay. I will follow. Okay. Thanks.
So firstly, I want to thank to Karina and to Maddalena for their presentation, because in fact, it is very important for us and for the people that are attending this meeting to know what happened in the future, because we want to have more people or to bring other stakeholders on board of this network. So it's important, and I know that there is here attending this workshop a lot of people that has not been enrolled in EPONAHA activities in the past. So for me, this is very important to start to know or to give at least a small overview about the work that has been developed during the last years. And I think it's clear for everybody that there is here a lot of work that has been done in the past. In fact, EPONAHA, and as Karina and Maddalena tell, is we during these 8 years of work together, we are now friends more than other things. So I think we have a very strong network with a lot of relations between us, and very strong relations between us. So taking this in our mind, I think it's important to know how we go to the future, because in fact, as you all know, EPONAHA, or the European Innovation Partnership, as we have worked in the past, do not exist anymore. What we have here, because the European Innovation Partnership stops in 31 of December of last year, and we have a perspective of being involved in the new partnerships that will come in 2022. So, and our main aims during these 2 years is to maintain this network and, if possible, start growing in this network. So I'm very, very interested to the future, and I'm going to ask 2 questions. One to Karina and the other to Madalena, in order to know their opinion. Because, and I start Karina. Karina, you present very, very fantastic work that has been developed in your group, in your action group. And in fact, a lot of projects that have started in this Iponaha ecosystem, leading by you and so on. How you see the future of the action groups? Because because we have during this week we have a lot of meetings with the different action groups. Only miss one. We have on next week the meeting with the A3 group, but we already have some ideas about the future forthcoming, and most of the people wants to continue work in this context of action groups, but they see they see the need of change the organizational model. And my question is, in your opinion, in what we need to be focused in these 2 years? In green paper priorities, in the next partnership priorities. How you see these 2 years in terms of action groups?
Thank you, Elisio. Well, I thought I knew how to answer you, but then the last part got me a bit lost again. So let me try, if you allow me to go step by step. So yeah. I know, as you probably understand, and for those who don't know, we have been discussing the future of the IP for some time now. Almost all the year of 2020 was discussing this. And well, of course, the outcomes are not the same for everyone. And what I can share here is a personal opinion, but the groups that have a lot of ongoing work try to find their own ways of progressing. And for example, in the case of D4, as you can see, there are either formal or informal organizations that are still continuing the work of the group, because this is a way of keeping its sustainability. So I do think that we possibly or probably don't need a number of new organizations or structures. However, what I do miss was the overarching structure that the Commission provided to the IP, because it recognized the work of the groups and the work of the different stakeholders as relevant for European strategy and policy. So I do hope this is still on the table at this point, and that there is a strong endorsement of the Commission on the work that all of this community is doing on the different streams. So for me, this would be maybe the first thing would be, it would be important to have an overarching structure. I don't think a very formal organization is needed, but we need to have an endorsement. We need to have it very clear. And if this is possible, I think this will be very relevant. On the second part, the groups are organized differently, and I do think that this was a nice point for us to understand which ones are progressing. As I was saying, for example, in time, we already progressed a little bit from only aging to life course approach and bringing in different synergies. I didn't say this before in the presentation, but we did a lot of collaborative work with other action groups, in fact. So we had specific collaborations with A3, B3, C2, etc., where we work together, and this needs to be maintained, I think. But at the same time, I think it's also a time to revise the priorities and to see if new ones need to be added, because reality changes, and for sure there are maybe 2 or 3 working lines that would make sense. For example, if I can talk on my hat of DCH Alliance now, the work on smart working environments, on having training for the workforce on digital and health literacy, etc. These are streams that were not that much covered in terms of the working environments in the previous EIP, and this is something that could be added here. So I think there is the time to see what's next and what's coming, but we need the structure first. Sorry, yes. I was already too long.
No. It's important, and for sure, your words have been very, very, very important for us. But it's only to clarify. In your opinion, we must continue with the same action groups that have that work in the past well, because we need. There is a need of change. Okay, it has been identified for for most of the stakeholders from the different action groups. But in your and now you are talking that probably it's better to continue with the action groups that have some work that have done some work. Is your opinion? Is that to clarify?
No, just to clarify, yeah. We will continue the work, for example, under the hat of SHAPE or of Net4H Friendly, either way. So this exists and this gathers a very big number of stakeholders. So we wouldn't change it. But we also evolved from age-friendly environments to smart, healthy, and age-friendly environments, and from the aging approach to the life course approach. So there is involvement, but I think this comes naturally within the groups. I'm sure that for other groups that are present here, they possibly can say the same. But of course, we won't throw everything away now because, well, of course, we will still maintain the work, let's say, either under this chapeau or not. I would like if we could maintain it under the same chapeau, of course.
Yes, of course. Thank you, Karina. Madalena, let me put you a very similar question, but now about the reference sites, okay? So, because we have now 102 reference sites identified across Europe, and of course, the reference site collaborative network has a strong, are very important management of these reference sites, and but of course we need to this new CSA has also some responsibilities on the reference side. And my question is, how you see this relation between RSN, the reference site collaborative network, and this new CSA in the management of this big community?
It's a difficult question. Wow.
Yes, I know.
I can try to respond, but I like democracy. So I think this should be I believe that co-creation is the key of success. So in the same line of Karina, I agree that having an overarching structure helps in ensuring that the impact of the IP is multi-level. We have seen that the most successful examples of scale-up and exchange happened when reference sites managed to connect local regional level with national level and international level, because this alignment helps in improving the impact of investments in terms of money and human resources. So if having, for example, a shared vision like we had in the blueprint and engaging all stakeholders in designing that shared vision that can evolve over time, because let me remind everyone that the blueprint is an evolving document, so it grows with us. The field we work in is a high turnover, a very fast turnover field. Health innovation is quick, so we need to have the readiness to ensure that these changes in innovation quickly reach from the top to the bottom. So this is what we can do together to improve the transfer of the innovative tools. If we set our system ensuring that the three levels are quickly connected, we can be altogether successful. This means that we need to grow the capacity at all three levels and develop interfaces. We talk about interfaces at digital level, but interfaces are human. Projects work on the legs of people. So you have to have people working together, sharing the ontology, sharing the culture, sharing the knowledge. Otherwise, it takes too long. By the time a policy is designed by WHO, it takes too long and possibly a pandemic in between before it arrives on the bottom and impacts the citizens, patients, the professionals, and the education system. So what we can improve is the readiness of the three levels in implementing. This is the core idea, I think, is important. I'm a clinician, I'm just a clinician. So if I look at my colleagues who are still busy in providing services, they struggle every day with a number of issues that there is plenty to develop. If we follow the methodology that now is better being defined by the blueprint and the personas of the blueprint, and in different projects like Vigor, Mobile Health Hub, and others, there are a number of synergies and alignments that the people busy in the project do not have the time to cultivate. So we could gain much from increasing the real exploitation of the products of the project while they are still being developed, because we can contribute to iteratively improve the impact of the projects and their results if we build bridges, meaningful bridges. I mean, tasks by tasks, not just general thoughts. You know what I mean? All of you, we are not people on the first experience in European projects. So we know very well how much work is in the deliverables, and it is too difficult to share between projects while you are busy doing the project. So there is a very strong need of these environments, collaborative environments, where we can share real challenges, because while you develop a tool, there is 3 more challenges coming up, but they don't fit into the project plan. So you cannot address those ones. You have to somehow try to bring home the result and then leave these 3 new challenges hanging, whereas they could hook into someone else's project and we could be much faster in driving the innovation home. Because in the end of the day, all we want is that innovations reach the end users. The end users can be clinicians, can be policymakers, can be educators. And if we are good enough, we may even manage to change our education and training systems on time to receive the innovations and deploy. So I think this is the future we should work. And there will not be enough action groups to work on all the challenges that emerge. So the action groups, like Karina said, know very well where to go. We had, you know, Elisio, you were there. So you know that we already are, as a matter of fact, reshaping the groups based on the experience, based on the results. We also agreed with you several times that the idea is to keep in mind that we must be challenge driven. So this means we need to look at problems and see how we can better solve them together, because health problems overcome the boundaries of medicine. It's not only a medical problem, it's not only a clinical problem. We need to make it sustainable. We need many more than clinicians to do it, because clinicians are too busy to react, to work with patients, and they do not have the time to work in the other 70% of the, of the ecosystem. And we need all the skills and knowledge and digital tools we can possibly reach to improve the sustainability.
Yeah, Madalena, I fully agree with you. The only question is, because, I posed only this, it's not a question, it's a comment, and you can comment also, because, and after Valentina can start. Only one question, because my question about action groups for Karina and also about reference sites for you is that we need to put more people on board. Okay, because as you know, and everybody that has been enrolled in EPONA activities in the past, there is a significant number of people that are very active in our activities, but we need to grow the number of the enrolled people. So, and we need to have a strategy for that, you know.
Eliseo, this is all volunteer work. So the system must be open and are open. RSEN action groups will be open. The action groups, I don't know about the management of other action groups, but the A3 action group has always been open. And let me tell you that whichever organization you want to adopt, my suggestion for you is that it is flexible. Because if you build a stiff structure, it won't be sustainable. Sustainability is grounded on voluntary work. So if you build procedures that are too complex to be implemented, it won't last. Our action group work, we have a coordination team. Sometimes it was 10 people, sometimes 8. Every couple of years we decided to change, but it was voluntary work because this year I have more time to take on my shoulders the coordination burden, because coordination is a burden. Let me tell you, horizontal activities are a burden. You need to ensure secretariat, you need to ensure a number of things, and you need to have voluntary people to invest in it. So you have to give these people the flexibility for them to enter and exit the system, because we all work in other organizations. So and it's not like going there and taking the spot because so that it's yours. No, it's about taking the shoulders and working with others. So my suggestion is, yes, imagine an organization structure, whichever there is, leave it on the shoulders of the coordination team internally so that they can exchange coordinators. It's a natural process. If you leave the action group, it will evolve naturally because some people will show up, some others won't. It won't be perfect. Perfection, I don't believe in perfection. I believe in improvement. So it won't be perfect, but it will generate sustainable products because peers evaluate themselves. It's a peer-to-peer interaction. So if you have professionals and they understand each other, and let me tell you, they evaluate each other even if it's not written in an evaluation form. So
thank you.
If I can add something on this note, just because of going broader and engage more people.
Yeah.
It's just to say that first, I don't believe that to change you need to take down everything that exists. So I do believe in improvement, like Maddalena was saying very nicely. And I think that the question that we need to engage other people actually goes very much in line what is already being done and was done by the action groups and the reference sites. Because as far as I remember, the way that we evolved and some regions evolved very well was because some of us were in action groups and could take down the knowledge and the experience that we learn, and we learn a lot with the others in the other countries, and could take that to our region and country. And this was a big asset for improvement. I do still think that we have a missing gap with companies. We have a very big missing gap with reimbursement policies and with funding within national and regional agencies. We have been addressing this for years and it's still not enough. I acknowledge that. But I do think that this is already so clear, so clarified. Everyone knows what are the big challenges. We have been trying to address them. We need to engage other countries, for example, Eastern Europe, etc. But still, this can be done in a more, let's say, improvement cycle, maybe, and not necessarily by trying to find new very quick solutions, because honestly I don't really think that there is a very quick and magic solution to this. I do think that we need to align policymakers and we need to align strategies, but I don't think we will have an answer to this like in half a year or something. It's a work in progress.
Valentina, go ahead. No.
Yeah, thank you. Thank you very much for all this very valuable contribution. And also because, I mean, you bring the dimension of what has been done so far, which is, of course, it's a lot. I feel like, you know, I knew a bit about you. Of course, I wasn't completely involved in the past in this exercise, but I have and understanding, let's say. So when I listen to you and your experiences, I feel there are really a lot of layers in this discussion, many. One is the topic that we are in a way addressing now, which is a bit also the governance and how to keep it, improve it, which is indeed actually very important. But at the same time, we are also organizing this event within the context of this new CSA. And the topic is really how to improve the scaling up of innovation within this CSA, how we can support you. And then there is the other topic, how to open up to other people that weren't involved since the very beginning and indeed address also the missing gaps that Karina was mentioning. So there are several discussions actually there. Of course, I mean, they're not going to end today, that's a matter of fact. So, I mean, from someone who is a bit an outsider, you know, my first question to you, it's, you know, back to the basic in a way, but really, according to you, to your experience, to what has been done up to now, really in terms of unmet health needs, where we need absolutely to prioritize the innovation that you have been experiencing also within the ARP on AHA community, where do you feel like in the future we should concentrate more? In the framework of this aging, paper of the Green Paper of the European Commission, in the framework of the topic of health and social care system transformation, if we should prioritize something, where we should start in terms of content, of how to address unmet health needs of aging population through innovation, because we don't want to reinvent the wheel. So what do we have, which is, you know, mature enough also to be scaled up at European level? Because this is a bit also the topic for our CSA.
Do you want to start, Madalena, or shall I?
You start.
Okay. Well, I honestly, I know that Elise already asked this, but I'm struggling with an answer because I just feel that they are complementary. I don't think, well, the Green Paper on Aging has a very transformative impulse within it. And of course, it matches maybe more directly the kind of thought that is also underlying SHAFE and our D4 group. But at the same time, this does not mean much at the end if it's not implemented in the health and care systems. So I do feel like they are different steps of the same process. You need to have an holistic approach, and then you need to start working with the authorities to make sure that things get there. Because at the end, and I can say this, for example, on behalf of Portugal, and I apologize to all the actors for saying this, but it's true. We have wonderful innovation in our country, and very little, if almost none, is embedded in the systems. And this is a question of the way that the healthcare system is designed, because it's very much top down and very much coming from a national level. So this is something that needs to be addressed within the authorities as well. So, I mean, I see this, the Green Paper on Aging as a policy strategic document that should be underlying the actions, but at the end, of course, that the partnership is also important to make sure we translate this into the right policy actions. So I find them complementary and not substitutes, let's say.
If I may catch up on what you just said earlier, you highlighted that there is a gap still pending. We could still work a lot on the interactions with the private sector. So there is an opportunity there to engage. You know, you can complete the cycle of innovation. We are very much oriented and unbalanced, possibly, on the need side. So we are very much focused on engaging policymakers, decision makers, and this side of the spectrum. And there may be a stronger focus on the more innovative, cutting edge with the startups, spin-offs, and companies. So, and how to develop this dialogue. This is very important. This is something that could be completed by this CSA, it would fit perfectly into that puzzle we are trying to piece together. And we could synergically work with the RSEN and the SHAFE to ensure that the elements of the ecosystem better engage in the quadruple helix. Because this model could be replicated in national and local regional levels. It would be very important if such a model of interaction could be designed at European level, and so that we can replicate it and implement it more successfully in our regional ecosystems.
Thank you.
Okay, so I think now we're going to move on to, I mean, we're just slightly off the mark in terms of time, but I think we'll be moving on to a more open-ended discussion. I see that Pirette has her hand raised, and this is actually the time for us to open the discussion with the audience. I would ask either to raise your hand or in the chat room, pose a question, I can read it out loud. So I don't know if Pirette, if you want to kick off with a question.
Yes, I have a question. If we talk about the impact of engaging stakeholders and all these big communities, what is the, like, maybe from this discussion, I don't know who wants to answer this question, like, what is the impact, like with one sentence, you're expecting from this collaboration and work? Like really, what helps you? What is the future, this heaven you would like to see?
Well, enhanced quality of life for people. That I think in a very well, sorry, not very elaborate way, but you ask for a sentence. This is it. We want people to be happier, more autonomous, and living with better quality of life. So I think that would be it. The rest is the ways to reach that, I think.
Yeah, but but if we think more about, yeah, for sure, this is the goal for innovation. But if we talk more specifically about the, like this framework or this collaboration, like what is the essence in your mind of this collaboration?
You mean the collaboration within the stakeholders present here?
Mm-hmm.
Yeah, well, that would be possibly to ensure that innovation reaches the communities and that reaches people at the end, because I think this is what we work for, all of us. So the collaboration should enable that the innovation is done in a proper way, that is addressing the right challenges, and that at the end is delivered to the people in their communities. I don't know, Madalena, if you want to.
Assessing impact depends on what you're looking for in the end. So Karina has been referring to the final outcome of impact we are looking for. But if you are referring, for example, to a specific good practice, you may define as an indicator, depending on your ambition, if you are adopting a good practice for preventing falls, for example, you may say, okay, how many falls I prevented? Or did I manage to have into the strategy of that region an action aimed at preventing falls that takes advantage of innovative tools? So your indicator will depend upon what you are looking at. So if it's a bit general, saying which impact are you trying to identify, it depends on what is the angle you are looking at.
Thank you.
Eliseo, Valentina, do you want to comment? Because this is a bit more open-ended part of the discussion.
Okay. Hello. Sorry to interrupt. Sonia, can you hear me?
Yeah, we can hear you, Sonia.
Yes, I can't raise my hand, but can I say comments?
Yeah, of course.
Yes. I think we have all the same goal in these networks, in these working groups. We want all together to find the best solutions for a healthy life, a good life, as long as possible at home for older people. So I think this is the goal where we are working for together. And therefore, it's very good to have these networks and working groups so we can discuss and improve, and we can also share our experience. And maybe we also can give our comments and send the Commission some information about what could be a good funding possibility, or which projects maybe could also improve the better lives for older people, and also, of course, for the financial situation in all the European countries and in regions and municipalities. So I think it's good to have these working groups and reference sites. Thanks.
So does anyone want to want to comment on this, discuss it a bit further?
Can I have a comment?
Yeah, I would just say, Patrick, let me just do one question and then we'll skip to yours, because I think mine is going to be relatively simple. This is pertaining to a point that Leo has done in the chat, and I want to connect it with something else. As you all know, we had a small survey to basically have a bit of a pulse on the opinion of our stakeholders in this network. And it's very interesting because Leo, on one hand, has pointed out the fact that, well, regarding innovation, little of any sustainability, and translating that type of innovation into business as usual is interesting, as a top-down approach to date is seen as a barrier. But yet the biggest change that has been achieved in decades, it's this last few months, this pandemic, and it has been largely top-down. So this is one point of discussion. The other one would be that some of the respondents, a lot of them talked about a lot of governance issues. So defining better strategic priorities, engaging more stakeholders and different stakeholders from different networks, and then promoting close collaboration. So we have two sides here. On one hand, we have a top-down approach that sometimes can work in a crisis environment. And on the other hand, we also have this claim for more stakeholders to be involved, for more collaboration to happen between all stakeholders in a quadruple helix, and even to involve more of the private and enterprise sectors. So I want you to discuss this. I know this is a very mixed bag of like two very different topics, but I want to hear a bit from you, what you think what is your comment on each one of these statements, basically?
Well, just very quickly, I do think that the key is to find the balance, because we always need to have some top-down decisions, but I do think that innovation has to be grassrooted and needs to come from real needs. So we need to start from there and then ensure that the right decisions are made top-down, but it has to start from the ground, in my opinion. Of course, it's a balance, I think.
Does anybody else want to comment on these two very different issues, by the way? Okay, so Patrick, please go ahead.
Yes, just to underline what Eliseo said, that we need more. We need more people engaged in this community. And we need to make more good activities in countries and regions explicitly visible in this cooperation. And that is why I wrote a comment, because Eliseo, we must ask the question: if we really want more people, what is the mechanism by which we bring in more people to this community? And I think, as I wrote in my remark, that I think that we need some kind of country-based documents, overviews of healthy aging in country. We can do this in small countries, like in the Nordic countries, Finland, Sweden, Denmark, Norway. We can do these kind of things when the population is less than 10 million, up to 10 million. We can't do it. You can't do it in Spain. You can't do it in Italy, but you can do it in Campania. You can do it in Andalusia. Andalusia has 8.5 million. I would love to see a document on healthy aging in Andalusia. I would love to see a document on healthy aging in a company, and they can be done. They can be done, and I think, Alicia, they should be done. They should be enforced. Why? Because the point is that if you actually can arrive at such a document, it makes no sense to have 10 documents on healthy aging in Andalusia. You must have one document on healthy aging in Andalusia. Portugal is maybe too big to have one for Portugal. Perhaps you need one for Algarve. Perhaps you need one for Alentejo. I don't know. It's up to you to decide. But I think we need these types of documents, because then you are creating a consensus in the regions and the small countries. And then you kind of get the people behind these documents. And that might be the mechanism by which you actually are able to, Eliseo, extend the volume, bring in more people into European cooperation. Thanks.
Patrick, I have a short question. Do you mean an agreement? We have our different agreements in the health, in the regions for the health sector. Such agreements, or what do you mean?
No, what I mean is that we actually have, Sonia, started in Finland, also in Sweden, to create a document, Healthy Aging in Finland. We go from the ministry, we go to the authorities, we go to the healthcare regions, and we boil down to the grassroots. I've had preliminary discussions in Sweden. I actually had the first discussion with Danes, and I've seen, 6, 7, 8 names in your country also. I would recommend you, Sonia, to do this. We are small countries. Danes are 5 million, Finns are 5 million, Swedes are 10, a little bit larger. We can do it. Also note that also for the others in Europe, when we speak of Europe as a whole, we are not the same. We are not exactly the same. The Nordic countries look like we do. The south of Europe look like you do. The mid of Europe look like it does. The eastern part look like it does. So there are the differences. And if we create such documents, we will actually have clusters of the documents based on which we see that here we do like so, in other parts you do like so, we compare, we change, we share, etc. So I think so, Sonia, for instance, in our Nordic communities, we can and we should promote these things more, because we have a history of being a Nordic community before the European community was a European community.
Okay, thanks for the comments. Now I'm going to go over to Angelo, which has the raised hand. As we've been in the last few discussion minutes, ask you to be brief, but I think it's working out well, so let's keep it going.
Okay, so thanks. I am a clinician, so sometimes we need to be straightforward and cannot call things with different names. So in my opinion, we are moving into a mature market. So the proliferation of initiative documents is also related to the fact that the concept and especially the wording of active and healthy aging has become a common domain, commonly used. So from politicians to people who want to sell food to any kind of initiatives. So that's also one of the reasons, because we have so many documents promoted by different entities. So how can we expand? How can we be more effective? To me, there are two main targets: either institution countries who are starting now to approach this system, and we can provide expertise, practice, and knowledge, or trying to promote and facilitate single scope, single topic initiative cross borders aimed at providing some evidence that something is effective. Otherwise, we all know that active and healthy aging is important. That is wonderful to do this, but then it's document, it's paper, it's word. So if you, with people who take decision with authorities, you got to talk. They are very keen to talk, but they do not always and not easily support financially initiatives because evidence are poor. So either we provide evidence or we share expertise with people who are starting like we did in the first years of EIP on AHA. Thanks.
I would just want to just quickly connect with Angelo commented that actually one of the topics that we also received from our forum is that we actually need more concrete metrics, goals, more actionable outputs. And I think this connects well with that. The idea that sometimes we are a bit too focused on discussing these issues, talking about these issues, and then the metrics and the implementation of it maybe sometimes is not as accompanied as it should be. So I don't know if any one of the panelists, any one of the speakers wants to comment, someone wants to pile something onto this discussion.
I must comment this because what Angelo tells is exactly what I think. Because in fact, during the last years, there is a lot of documents coming out, but in fact, we don't have a clear strategy to implement even what comes out from the European projects. And I think this is a problem that must be solved because most of the projects and the outputs of the projects, and everybody knows this, this is a European problem. Most of the European projects have no impact, in fact, in real life. And Angelo, what you tell is I fully agree.
Any more comments, questions, points of discussion?
Can I have just a brief remark on Angelo's?
Yeah, of course, of course.
Just to say, Karina, your cost program is an excellent thing, and we should learn from that cost program. Angelo is part of a cost program. I am also part of a cost program on vascular aging. It's a different thing, but the structure of these cost programs are nice. The structure and the engagement of the experts in this cost program. So I would, Karina, suggest for you, if you don't know this vascular aging cost program, even if it's about the vascular aging, so it's a different area. But if you haven't seen this program, and since Angelo is here, you might want to compare it. Also note that Angelo and I are working on the big data. We have a subgroup in this course program on big data. Also, that is what we miss a little bit, I think, in APONAHA. We have spoken about this for the past 8 years, information and process. What is the scope of data we deal with in active and healthy aging? And Angelo, I think we might learn a little bit from the cost program. In the same way, Angelo, as the cost program on vascular aging can learn a little bit about functions and ICF. You know how much I have promoted ICF also for the cardio side. So here we have two cost programs with different content, but I think we can learn from the structure of how they drive the administration. Thanks. And good Angelo, to see you. I was surprised to see you in
Thanks.
Thanks.
Okay, so Eliseo, Valentina, Karina, Madalena, is there something you want to put forward in terms of discussion?
I was just going to say that this, what Angelo Scuteri just highlighted, might spot a weakness that is the link with the scientific societies. this is something we should surely take into account. There must be a way to better connect with scientific societies and the research communities. So I was wondering whether there is somewhere this CSA could do to better connect us with the KIC community, the knowledge innovation community. That would be a top-down approach. So.
Valentina, do you want to put some question or I can? Because we don't have a lot of time.
Well, so. No. The only thing that, I mean, I agree with most of the things that has been said, and also the fragmentation actually with all these projects and how to embed the results actually in policy making, in health system change and transformation. This is something that we need absolutely also to tackle within our CSA. And this is why I was trying to understand what should be prioritized in a way, because I don't think that we can actually, you know, moving forward with everything. So step by step, we will probably discover this, and this would also help in improving, for instance, the dialogue with the private sector as well, because we need to involve them more, and we need to change this dialogue since the very beginning. So of course, innovation cannot be embedded sometimes in the health and social care system, because if we don't start with this dialogue and what is lacking from a health and social care system point of view, sometimes you produce probably an innovation that someone cannot absorb. So these are all things that we absolutely need to address also in our CSA, and it's going to be a long journey, I guess. Back to you, Elise.
Thank you, Valentina. I think we are finished.
One of the things is I'm sitting in more meetings, and one of the big gap analyze what I've made is that the same question is also by patient organizations and that kind of things. There's a lot of in common in the same question. Only there is no general strategic approach from the EU to combine it and make the gap analysis as a real target to recognize. That's the point. And then you lost it. You understand? To bring the same, everybody has the same problems in the communities, to bring it out. Everybody is looking to each other and talks to each other, but can not bring out on a different levels, not only on country or region, but by the citizens themselves. You had to communicate that, what you're doing and what you achieve. A lot of things are not recognized or don't know. Because the communication is very important.
Yeah, for sure. Thank you, Arthur. Can I pose a last question? A very provocatory question. It's not too much, to be honest with you. Because in fact, there is a lot of networks across Europe. We have RSN, Eureka, Edge Platform. There is a lot of networks, and some of they are quite complementary. I'm not telling that they are doing the same thing. No, they are very complementary, but the people enrolled in most of these networks are always the same. And I put here a question about how you think and our view about linking all these networks across Europe. We need a link between this, or no? What do you think about?
No.
Patrick, sorry.
Patrick.
If you take Edge Platform, Edge Platform, it's a pensioner organization, basically.
Patrick, I'm not talking about a specific organization. I give some examples that
what I mean is that they represent different kinds of people. So that's the reason. The ones that lead these organizations may be connected, but the people they represent are disjoint. The set of people they represent are often disjoint. So that's why I suggest not to connect the administration, because that does not mean that you are connecting the people.
I like the idea. I like the idea of connecting the network, and it should be a big community, a loose community, not a network. So not a structured community, a loose community of stakeholders that work their own pathways into their own organization and eventually can develop synergies to speed up certain specific objectives. Because what you can do across networks is create an alliance to go from 10 miles an hour to 100 miles an hour. So you'd give a super boost to specific challenges. For example, the COVID is perfect example. So there are some specific challenges and we were forced. But if we were had that kind of connection before COVID, then there were data we could have shared, knowledge and so on and so forth. So
on a very, if I can just compliment on a very pragmatic way, I think a lot of us are already connected. So a lot of the networks you referred and others, we already work together several times. And for example, we do this with RSCN and A3 and etc. We have meetings and in the Covenant, the same with H platform and etc. So this exists. But when in the beginning we were discussing this overarching framework for the IT, I think this is exactly what we were discussing, was that there was a common chapeau that connected not only networks, but also organizations and of course, the people that represent them. So I think that's in line with what we were thinking as well.
Also, just to, because we're almost closing up, but Anna, she raised her hand, so please.
Thank you, and good afternoon to everybody. And congratulations for this big getting together. I think it's a very important starting point for the new CSA. I just wanted to add what has been said before by the other colleagues, that I think that the connections and the involvement of everybody is very important. I think we need to be included and inclusive with everybody, and the connection among it is true that the different networks do not represent exactly the same thing, and maybe you find similar people or the same people representing a region, and I can see myself doing that as well. But when I speak on behalf of the Reference Site Collaborative Network, you know, Alicia and my colleagues that I'm involved in the executive board, I have a different hat, and the people behind me, it's not my region, it's the collection of all reference sites. So we can play different roles, but I think that it is important. I think it's a turning point for the whole community to move into a different, and something that was said before regarding, do we need the same action group? Do we need to connect the reference site? I think we need to step on what we have achieved in the EIP and in the different, in all these movements, in the connections that we have among the different networks, and see the valuable things, be able to look at each other and to learn from each other and to move ahead, and with the purpose of having a better society. That is, I think that is a common goal. Not only focusing with a life course approach. I think it's very important to focus on the whole process, not only on the specific items for the elderly, because anyway, we will reach there. But I just wanted to comment on this need for collaboration among everybody. And I think that is a very important point for everybody. Thank you.
Okay, so thanks a lot, Anna. I mean, we're all out of time, so this was a great discussion, a great workshop. What do I need to say? Well, first of all, thanks a lot for everyone who has attended. Special thanks to the speakers, Elisio, Karina, Valentina, Madalena, and Piret. So thanks a lot for being here with us and helping us guide this discussion, helping us guide this workshop. And so basically, what can I say next? We're going to send some meeting notes on this workshop. So I think everyone should receive those meeting notes. So we can even generate more discussion afterwards through email and meetings and so on, because this was the fundamental objective of this workshop, was for us to understand how can we warm up to stakeholders to start this conversation and to present this project, because we're going to be working for the next 2 years closely, and we do believe that we kind of needed something to start it. So I think this was completely accomplished, and from now it will only grow in terms of collaboration. So thanks a lot, everyone. We'll be closing off the meeting, and in the future, anything from our end, please feel free to reach out. Okay, bye-bye.
Thank you. Bye.
Thank you. Thanks so much.